Intracranial hemorrhage refers to bleeding within the cranial vault, and it is a neurological emergency. And rapid diagnosis through imaging is very crucial and primarily done by the non-contrast CT scan. Intracranial hemorrhage can be broadly classified into the traumatic hemorrhage and non-traumatic hemorrhage. And based on location, hemorrhage can be divided into the epidural, subdural, subarachnoid, brain parenchyma or contusion, and ventricular system. So collection within the epidural space is called epidural hemorrhage or hematoma. As we can see in this image, this is the epidural hemorrhage. Subdural, this is the subdural. Subarachnoid, within the sulci or subarachnoid space, and brain parenchyma, that is the lobar or within the deep intracerebral hemorrhage, and ventricular system, and hemorrhage within the this ventricular system. In this video, briefly I will describe about the traumatic intracranial hemorrhage. So trauma is the one of the most common cause of intracranial hemorrhage, especially in young adults and also within the elderly patients. So here we can see that this is the intracranial hemorrhage and is associated with this is the calvareal bone fracture. Now first one is the epidural hematoma or extradural hematoma. So its location is in between the skull and the dura mater. So this is the skull and this green is the dura mater, and this red color is the collection. So this is the representative image showing the different layer of dura and calvarium, and this collection is called the epidural or extradural hematoma. Its common cause is the skull fracture with arterial injury, classically the middle meningeal artery. Now the imaging findings. So most common or modality of choice is the non-contrast CT scan. So I will describe here the CT findings. So it is a lentiform or biconvex shaped extraaxial collection. This is the biconvex shaped or lentiform shaped collection, as we can see in this image. Collection is hyperdense, as we can see here. Hyperdense means bright color. Then it is limited by suture or it does not crosses the suture. So this is a very important point for the epidural hematoma. It does not crosses the suture line, and it causes the mass effect, as we can see in this image, causing the compression of the adjacent brain parenchyma. And we can see there is a midline shift here. This is the midline. We can see that the ventricle and the basal ganglia is also shifted to the right side. So this is the mass effect and midline shift. Often is associated with the calvareal fracture, as we can see in this image. This is the coronal image showing the calvareal bone fracture. There is a very important sign called swirl sign. So it is mostly associated with the epidural hematoma. So what is the swirl sign? It is a critical marker of active bleeding. So appearing as an area of lower density, as we can see in this image, lower density within the hyperdense collection or clot. So this is the hyperdense area, bright area, as I said in both images. This is the hyperdense area and this dark is the hypodense area. So this indicates that the rapid hematoma expansion. And if we see in CT this kind of hypodensity within the collection, so this shows that the rapidly expanding hematoma, and it requires immediate surgical evacuation of the collection, so to reduce the or to minimize the mortality. So this is a very important sign, swirl sign. Lucid interval is the clinical clue for the diagnosis of the epidural hematoma. So what is the lucid interval? It is the period of consciousness or normal state in between the two periods of unconsciousness or confusion. What happens in this initial period of confusion or unconsciousness occur due to the concussion of brain parenchyma, as we can see here. So this occurs first period of unconsciousness due to the concussion, and second period of unconsciousness occurs due to the intracranial hematoma causing the compression of brain parenchyma. So in between these two period of unconsciousness, there is a period of normal state or consciousness, and this is called the period of lucidity or lucid interval. It is a very important clue for the diagnosis of the or suspicion for the epidural hematoma. Subdural hematoma. It is a collection between the dura and the arachnoid. Where here we can see that this is the red color is the collection in between this green color dura and this white color is the arachnoid matter, and it occurs due to the tearing of bridging vein. Imaging finding of subdural hematoma is the crescent shaped collection. As we can see in this image, this is the crescent shaped collection. This is also hyperdense collection. As we can see here, it crosses the suture line. So here we can see that this is the suture line. It crosses the suture line, whereas the epidural hematoma does not crosses the suture line. So this is the different point, and it does not crosses the midline, or it is limited by the falx. So we can see it is limited by the falx, and whereas the epidural hematoma can crosses the midline, but they are limited by the suture line. Now another one is the traumatic subarachnoid hemorrhage. Its location is in the sulci and the basal cistern. As we see here, these are the sulci, these are the sulci. So location is in the sulci and the basal cisterns. CT findings are the hyperdense collection within the sulci. As we can see here, these are the hyperdense collection within the sylvian fissure. This is the interhemispheric. There is a collection within the sulci, and it's often associated with the contusion if it is traumatic, and if it is not traumatic, then it could be associated with the other pathology like AVM, aneurysm, rupture. So this is the collection in sulci and the basal cistern. Cerebral contusion or hemorrhagic contusion. So this is due to the brain parenchyma injury, and its common location are the frontal lobe and the temporal lobes. So these are important for the MCQ purpose. Frontal and temporal lobes are the most common site of cerebral or hemorrhagic contusion. Imaging finding are the ill-defined hyperdense areas, as we can see here, and associated with the brain parenchyma edema. So these are the hypodense areas are the these are the edema, and these ill-defined areas are the contusion, and is often associated with the subarachnoid. As we can see here, these are the subarachnoid hemorrhage, and they may enlarge in 24 to 48 hours. This is also important for the MCQ purpose. So they may enlarge in 24 to 48 hours, and blooming can be seen in GRE sequence of MRI. So these are the blooming showing the hemorrhagic contusion. Now the diffuse axonal injury. So it is a very important and very critical type of injury. Occurs due to the acceleration deceleration injury. As we can see in this image, there is a very rapid acceleration and deceleration causing the axonal injury. So what happens in this? What is the mechanism? A severe form of brain trauma causing rapid acceleration, deceleration, or rotation force. In this acceleration, deceleration, or rotation forces are very high in speed, like high speed motor vehicle accidents, fall from height, or second baby syndrome. So these shearing forces stretches the axons, or twist or tear axons and small vessels of brain parenchyma, leading to widespread brain damage, immediate coma, or in many cases persist vegetative state. So what happens? As we can see in this image, there is a very high speed acceleration and deceleration injury, leading to the twisting or shearing force along the axons of the neuron. As we can see, this is denoted by this black line, and this will causing the injury of the axon. Here we can see there is a immediate shearing or injury. Here we can see that this will lead to the diffuse axonal injury. So this is about the mechanism of injury. Now the imaging finding of diffuse axonal injury. So initial CT shows normal findings. So for the diffuse axonal injury, MRI is the investigation of choice, especially the SWI or T2 gradient. So what we see in this, the multiple small hemorrhagic foci seen in the typical locations like gray-white junction. Here we can see, and the corpus callosum. This is the area of the splenium of the corpus callosum, and also in the brainstem. So if case of trauma presenting with the hemorrhagic foci at the gray-white junction, corpus callosum, brainstem, then think of the diffuse axonal injury. In trauma, there is a injury of brain due to the direct impact over the brain parenchyma, but there is a special type of or we miss sometimes the finding in the brain trauma, that is the coup or contour coup injury. So what is the coup and what is the contour coup? Coup is the direct site of direct impact. As we can see here, this is the direct impact. So this is the coup, this area is the coup, and there is a rebound injury over the opposite side. As we can see here, this is called the contour coup. So in case of trauma, think of the contour coup injury. So evaluate image very carefully and see both sides at the site of coup or direct impact, and also the opposite of the direct impact, that is called the contour coup injury. Now the imaging modalities for the brain injury or trauma. Non-contrast CT is the first line of imaging. It shows the rapid modality of imaging and it detects acute hemorrhage as a hyperdense collection. Now the MRI brain. So GRE or SWI sequence is essential for the detection of the microbleeds as in the diffuse axonal injury, and FLAIR detects the subarachnoid hemorrhage in subacute phases, whereas the in acute phases CT is the best modality of choice. CT angiogram is essential for the detection of aneurysm or AVM in cases of non-traumatic brain injury. Now the radiology reporting checklists. What are the checklists? First one is the C for the location. As I said that the coup and contour coup and intraaxial or extraaxial lesion. Then go for the size of the collection or lesion. Density. So density decides or help in the diagnosis of the age of the bleed or duration of trauma. Mass effect associated with that injury or collection. Midline shift, hydrocephalus, these both are the component of the mass effect. Fracture, so associated calvarial fracture, intraventricular extension of the collection or hemorrhage, and also C for the non-traumatic cause for the brain hemorrhage, because sometimes due to the non-traumatic cause of intracranial hemorrhage, patient fall down and we misdiagnose at that this is due to the trauma. These are my references. Thank you for watching. Keep watching my channel to get more such video, and please comment if this video is helpful for you. Thank you.